This is WZRD Chicago 88.3 FM. And we have with us on WZRD via Zoom Kevin Clenna, who is a Chicago Police Department officer, and also he will be discussing with us about Medicare fraud. Hello, Kevin. Can you hear us? Can you
Hello,
hear me?
Trudy. Yes, I can, Trudy.
Okay, let me turn you up a little bit better. Okay, here we go. All right. So first of all, Kevin, are you currently a Chicago police officer?
No, ma'am, I'm retired. I retired in August 2020.
Oh, okay. All right. Well, um, we met yesterday on the south side, and you wanted to discuss how you encountered Medicare fraud concerning an incident, several incidents, I guess, with your mother. So could
Yeah.
you tell us what happened?
Okay, my mother went into the hospital. My mother's name was Liarma. She
Mhm.
went into the hospital on the 9th of January. And by the 18th of January, she went into the hospital at Thorek Hospital at 850 West on Urban Park Road. And by the 18th of January, she was deceased. But during that time, I wasn't allowed to visit her for 9 days. I'm her power of attorney. I wasn't allowed to intervene on her behalf or do anything because Thoric at the time had a no visitor policy. So I couldn't check on her well-being and determine whether or not she was being treated uh, properly. Okay, had she been receiving her standard of care as required by Medicare, Medicaid. So as a result, my mother passing away, I had gone up there to actually they called me maybe around a Wednesday and told me one of the nurses and says that my mother required oxygen and they would have to send her to a facility that provides oxygen. And I said, well, no, she can have oxygen here at home. But they said, no, she has to be sent to a facility. I said, well, give her the prescription for the oxygen and send her home with oxygen and she can have oxygen here at the house. And they were like, no. One of the nurses says no. She clearly said no. So as a result, I was forced to go out and purchase. My mother, keep in mind, she has Medicare. I was forced to go out and purchase oxygen concentrators, which I did, which I have the receipts for. And by the time they arrived at my house, my mother was deceased. As a result, I thought that was something very suspicious that they would not provide oxygen at home since that's the norm for especially for senior citizens. So I started to because I went up there and I demanded the prescription for the oxygen. I just simply Googled the doctor's name. You know, Googled the doctor's name. His name was Dr. Buddharaju. And if you Google Dr. Buddharaju and you put the word complaint behind it, you'll discover that this doctor, according to the FBI complaint, he was mentioned in an FBI sting where about 11 or 12 of his coworkers went to prison for Medicare fraud, and he, for some reason, he was never tried or anything. So, but at the same time, there's a lot of articles revolving around his alleged actions. There was a lot of articles, such as Crane's Business. They had articles on him. Bangalore Daily News. Um, lots of articles that he was doing unnecessary intubations and unnecessary tracheostomies on patients, and he has been. If you can you see this, he has been named in at least 10 medical malpractice lawsuits as a result. So those are his some of his active lawsuits, medical malpractice, wrongful death lawsuits right now. But he now works at Thorek Hospital. This doctor, this doctor now works at Thorek Hospital. This is a prescription. This is a prescription that was written supposedly by him. I don't think this is his handwriting. I think this is his nurse accomplice's handwriting right here, Dr. Buddharaju, if you can see this in the corner. And so How is it that this man has been named by the FBI as Physician D by the FBI, is named in 10 lawsuits, never been tried criminally for anything that he has done, but yet at the same time, he gets to go on and become a supervisor at some of our local hospitals. I mean, this is crazy, and this is actually embarrassing. Can you see this? Bangalore Daily News, FBI, Chicago hospital uh, kept the patients too sedated so they can continue to do, continue on with their Medicare fraud. So
Is
this
that
doctor,
is that Bangor, Maine?
Bangor, Maine, yes, Bangor Daily News, yes, Bangor, Maine, right. So what I'm saying is these articles appeared all over the country regarding this hospital, Sacred Heart Hospital in Chicago. And
Was it so?
yeah,
Sacred Heart Hospital is the original hospital where those 11 or 12 other physicians were charged, but Dr.
exactly.
Buddharaju was not charged.
Exactly. Buddharaju was not charged. And the question is, why was he not charged? Why was he not questioned? Well, as a result, me doing some more and more research, I found out that it appears to be a politically connected hospital. And when I say politically connected, it appears to be a hospital that belongs to, let's see if we get these names right here. Actually, right.
Yeah,
So one of the
let's go into a little deeper background, a little deeper description of what happened in the beginning, and then we'll move on to the current situation at Thorek Hospital. Would that be okay?
okay, okay.
Okay. So when your mother was admitted on the 9th, on what day did the nurse or the hospital ask you for permission to get oxygen for your mother?
Well, she wouldn't approve the oxygen, but she wanted to send my mother to a facility around the 14th. I have the time frames written down, and they've been submitted to the through a complaint through HHS through a complaint. So I would say it was around Wednesday the 14th of January, but don't quote me on that.
And mhm. And then also, was this at the Thorek Hospital? Where was this at?
This is Thorek Hospital. This is one of the nurses from Thorek Hospital.
Okay, and your mother was at Thorek Hospital.
Yes, my mother was at Thorek Hospital.
Okay, and what is this about no visiting? Mostly, a lot of hospitals, the pandemic right now isn't treated as seriously as before. What do they mean by no visiting and no visitor policy? Does that mean that you cannot consult with your mother about her care? Was she awake?
Exactly, exactly. My mother was 88 years old, and I wasn't allowed to consult with my mother about her care, which was apparently, I found out later on, against HHS rules, actually.
Okay.
So basically, they've been allowed to operate and do what they want to do on their own.
Mhm. And when did they provide you daily updates about her care, what she was giving, what was happening to her?
No daily updates. I would call daily, but I would never receive a phone call from anyone at the hospital. I would request phone calls from the doctors. I never received one. To this date, I've not received a phone call from a doctor. I have received a phone call from that nurse on the Wednesday, and maybe within the last 24 hours of my mother's prior to her dying, I received maybe a couple of phone calls. But other than that, I wasn't allowed to intervene. And even though I was the power of attorney for health and medical, I wasn't allowed to do anything.
And how did your mother end up at Thorek Hospital in the first place? Why choose Thorek Hospital?
She had actually been taken by ambulance to Thorek Hospital because we actually don't live too far from there, maybe just a few blocks. She had lost her breath. That's what, according to her, when she came back to, she said, "I lost my breath." So
Mhm. And when was the last time you spoke with your mother then?
I would say it was probably, let's see, she called me on maybe Wednesday or Thursday.
So
She,
that's the 14th or the 15th?
Yes, around that time. Around that time. I like to say I have everything written down.
Mhm. And also, what did your mother tell you about anything? What did she describe to you about what was happening to her at the hospital?
She said that she had fallen. Trudy, can you see me?
Yes, yes, yes,
Yeah,
yes.
she said that she had actually fallen, and that she wanted to return home, but we were trying to tell her that she needs oxygen, and we're buying the oxygen for her. We're going to get her home. But I was not aware that this doctor, and they had a Medicare fraud scam going on in that hospital. I wasn't aware of that. I wasn't aware that they would even hire or retain a doctor of his ill reputation at the hospital.
Also, so your mom fell at the hospital as well. Is that what she said?
According to her, she had fallen. Yes,
And did they treat her? Did she hurt herself when she fell?
we can't determine that at this point.
Mhm.
I did have an autopsy performed on her, and we found out that there was a pill lodged in her throat. And based on me reading the records and other people reading the records, we determined that that pill had been lodged in her throat for almost 24 hours prior to her being pronounced dead.
Did that interfere with her breathing because the pill was lodged there?
I'm almost certain. I'm almost certain it does because my mother had been diagnosed with this mild dysphagia, which that's your ability to swallow properly.
Mhm. Right.
At Rush Hospital, maybe about 6 months earlier, and they said she required her dentures to eat without assistance, but Thorek Hospital denied her medically necessary dentures, and they put her on a regular diet actually.
And if you had known about that as her power of attorney, and if you had directed her care, you would have put an end to that then.
Exactly right.
Okay. So after you discovered a lot of this, could you tell us about who you appealed to before we go into the rest of that?
I appeal to the U.S. Department of Health and Human Services Office for Civil Rights, OCR, which enforces the federal rights and laws. So I appeal to them. You have only 180 days to file complaints with them, and I was actually able to get it in a timely manner.
Mhm.
So I'm awaiting their ruling. I'm awaiting what they say. So far, I filed two complaints, and two complaints they've come back in my favor. But this is through the federal government, HHS,
Mhm. Okay.
civil rights complaint through HHS through a healthcare violation.
Mhm. And then who did you file with other agencies, other entities?
Yes, I believe I filed with the Illinois Department of, I don't have those in front of me, Illinois Department of Public Health, and I
Okay.
filed with another agency here in Illinois. But truly, like I mentioned yesterday, I don't trust these agencies here in Chicago and Illinois because of the fact that I've since found out that this hospital is politically connected. So I don't think that I'm going to get any type of justice with any of these local agencies.
Well, do you still plan on filing with them anyway, so that at least you have it on record that you have filed, even if you despite what you think, do you still feel that are you still planning to file anyway, just to have it on record that you have filed?
Well, actually, like I said, I did file with the Illinois Department of Public Health.
Hmm.
They responded, "Thank you. This matter is being corrective actions has been taken. I need to follow up to find out what corrective actions have been taken. What does that mean?"
Okay.
So I did file with the state of Illinois. I mentioned earlier that I'd actually emailed the Cook County State's Attorney's Office, and I got no response. So I had those records to show that I did email them. I was actually advised yesterday to do it again to follow up. So you'll have records, and I probably will. More than likely, I will, just to have a record that not only did you file complaints once or twice, but you did it again.
Mhm. Okay. And also, besides Dr. Buddharaju, do you know if there was any other doctor at Sacred Heart Hospital that was also not indicted, even though they were part of the investigation?
Yes, there was one. I believe, there was one doctor that was found not guilty. So this is what I'm not sure about, Trudy. One doctor, according to the FBI press releases, one doctor was found not guilty, and they said one doctor actually, his name was, I believe, was Oliveri, something like that. I don't have his name with me, but he was actually mentioned several times in the lawsuits with Dr. Buddharaju. So one other doctor, for facts, at least one other doctor did not go to jail.
Mhm. Okay.
And I don't know where he is now. I didn't see his name on any of my mother's paperwork or anything like that, but his name was Oliveri or something to that effect.
Mhm.
So
And
so I don't know if he got found not guilty or he just simply didn't have enough to charge him. I don't know what was going on with that.
what about Dr. Buddharaju in that Sacred Heart Hospital case? Was he found not guilty? What happened to him?
He was never ever tried. He was never ever questioned. Even some of the attorneys for some of the other doctors that were saying basically, "Hey, you're bringing this case forward and you're making all these allegations based on what he did, but you're not trying him. Why are you not trying him?" They were saying that in open court.
Mhm. The other defense attorneys or
Yes, the other defense attorneys, the people, the lawyers that were defending the other defendants, their clients, were
Mhm.
saying, "Why is he not being tried?" They were questioning openly. At least one attorney questioned openly, "Why is he not being tried when you all are basing all of your sensationalism about this case on what he actually supposedly did, but you're
Mhm.
not trying him?" They questioned that literally.
Mhm. And who was the prosecutor in this case at what government level?
They were federal, of course, they were federal prosecutors. I recall the name Hammerman. But this complaint, actually, this 90-page complaint, 14 pages of which is dedicated to Dr. Buddharaju, it can be found online through several links. This is not hard to find up. All you have to do is Google 90-page FBI complaint, Sacred Heart Hospital, and it'll come up. And that's how I was able to get it. It
Okay.
was just simple Google. And actually, WGN, W, W, I believe it's WTTW, I believe that, they actually have a link to the 90-page complaint.
Okay.
And, but what was the question, Trudy? What was the question
Uh,
again?
um, who was the prosecutor in the case? That at what the government level was he being tried? Dr. Buddharaju.
Oh, the highest level. He actually. Oh, Dr. Buddharaju. Let me make it clear.
Oh yeah,
Dr.
not he wasn't tried, but the other ones. I'm saying the
Oh, yeah,
Sacred
right,
Heart Hospital
exactly right.
case.
Yeah, Dr. Buddharaju was not. It was the United States District Court, Northern District of Illinois, Eastern Division.
Okay.
And the attorneys are Joel M. Hammerman, Ryan S. Hedges, Tara Reynolds. Those are the attorneys for the United States government.
Oh, okay. And how just for a little bit of background, those physicians that were tried, how many of them were found guilty? And there was only one that was found not guilty. All of
Right.
them.
There was definitely one found not guilty, but I want to say 11 of the 13 people involved so were actually found guilty and actually sent to prison.
Mhm.
Like 11 or 13.
And of those cases that they were tried, did any of them also involve intubations?
Not that I can recall. No, no, not that I read. Oliveri, he actually was one of the. He's actually named in the lawsuits, the medical malpractice lawsuits with Dr. Buddharaju. But no, it looks like they were actually just simply billing and
Mhm.
doing other things, and they were doing referrals and other things with the hospital, which is illegal. So that's where they got caught up in, and they got caught up on wiretaps. So you had tapes and other employees that were wearing wires during the Sacred Heart investigation, and that's what happened, and that's how they were actually caught. No, I can't recall any other doctors performing tracheostomies.
Oh, and those was that the cause of Sacred Heart Hospital closing, or was it something else? Was it
It was all of the above. It was all of the above. The FBI, the charges leveled by the FBI, the Medicare fraud and scandal, all of that substandard care at Sacred Heart Hospital involving nursing homes and other things, all of the above. That's why they closed. It needed to close.
Mhm. And also, do you know how an approximate amount of fraud that happened? Did it state in the case how much money it was defrauded from the government?
That I don't recall the numbers, but it was apparently in the actual numbers, but it was actually in the millions. But to give you some idea, every time they were able to perform a tracheostomy, the goal was to keep the patient intubated and under their control for at least 28 days. If they could keep the patient under their control for 28 days, they would in fact receive $160,000 per patient. And that was at least 10 years ago. But in addition to the money that they got for the surgeries, you got daily follow-ups on this particular patient. You could go in and say, okay, I can bill Medicare or Medicaid for this or that because I went to go check on this patient, went to do this and do that. But at the time, the goal was 28 days, $160,000 per patient. And according to the FBI's reports, they had, at least at that moment, 8 patients they had identified as being caught up in that particular scandal. So in other words, I'm going to literally make an incision in your throat, intubate you, and do other things for 28 days, and the hospital is gonna make $160,000, and it was okay with them. They say that's what was actually unusual about this. Most Medicare fraud simply involve overbilling and other things, but they were actually deliberately cutting on people when it wasn't necessary to cut on people.
Yes, and these were those 11 physicians at the Sacred Heart Hospital. They did at least 8 tracheostomies so for unnecessary tracheostomies so that the patients would be there for 28 days, right? Is that what you're
Yes,
saying?
and they would get $160,000 basically per head.
Mhm. Okay. So okay, now we could move on to more about Dr. Buddharaju. You just continue on what you were saying earlier then.
Right.
Uh,
So Dr. Buddharaju, once again, he had not been charged or has not been charged with any crimes. And I guess that's my burning question is why hasn't he been charged with any crimes, or why hasn't anybody yanked his license or done anything? So Dr. Buddharaju works actually during that time, Dr. Buddharaju had been named um, as in a lawsuit with Thorek Hospital. Him and Thorek Hospital have been named in a lawsuit as early as 2010. So they actually had a relationship dating back to 2010. The scandal broke in the Sacred Heart scandal, where Dr. Buddharaju also worked at, actually broke in 2012, which means that would have given Thorek Hospital, that means they would have known what Dr. Buddharaju was accused of, and they should have monitored him and they should have supervised him at the very least, if not terminated him. But they kept him on.
At the
So
Thorek Hospital in 2010, was Dr. Buddharaju in an administrative position or just a position there?
he's just named as a doctor in a lawsuit in 2010. He's
Okay.
named as a doctor in a lawsuit with Thorek Hospital in 2010, I
Do you
believe.
know what that lawsuit consisted of?
Let's see. I'm gonna look at the 2010 medical. Well, all of his lawsuits are medical malpractice and other personal injury, wrongful death. That's all of his lawsuits that I can pull up on this one. So that's what it is. And this can be found on the full electronic docket search for the Chancery Domestic Child Civil and Law Searches. This is public record.
Send us the link later so that we could provide it in the description for our interview. So our listeners and also the viewers of the YouTube video of this interview, they could click on it and then get to these documents.
Okay, now Trudy, now you aware I sent you, did you get some of the documents that I emailed yesterday? Yes. Okay, yeah.
Yes.
Because this document is actually in there.
Okay, awesome. Yeah, you sent me the PDFs. And also if you don't mind, it's not that big of a deal, but try not to mention my name on the air, because while we're on the air, we wizards or DJs for WZRD try to remain anonymous.
I'm sorry.
That's
sorry.
Okay.
I wasn't aware.
That's okay.
I wasn't aware of the ground rules when I started.
Yeah, that's okay.
Sorry.
No problem at all. Okay. So so it's all malpractice. And then so in 2010, while he was a doctor at the Thorek Hospital, Dr. Buddharaju was already involved in a lawsuit. And then in 2012 was when the Sacred Heart Hospital case broke. And how long did it take for those physicians to get indicted? Well, not indicted, found guilty.
I think we're around the year 2013. I believe that's when the trial actually ended.
Okay.
Around 2013.
Okay. And then do you know when Dr. Buddharaju in the Thorek Hospital became a physician, became an administrator? Is he an administrator at the hospital now, or is he still only a physician?
He's a like a chief pulmonologist at several at several hospitals. One of them being Weiss Hospital in Chicago, right up the street, Weiss Hospital. So he's actually one of the chief pulmonologists at Weiss Hospital. But he has actually, so you know what's so ironic? Kindred Nursing Home is named in a lot of the lawsuits, a lot of these 10 lawsuits, Kindred Nursing Home. He's still employed by Kindred, according to his, he's published a book and he's still employed by Kindred.
Oh, okay.
According to him. So here it is, you got sued by some of the patients at Kindred, but yet you turn around and you get to keep being employed at Kindred.
Also as in an administrative position or as a physician?
I don't know what position he is at Kindred. I'm not really sure, but doctor for certain though. But according to his book, he's still working at Kindred. And I just find that so ironic that here it is, you get sued by the patients at Kindred, but yet they keep you.
What other hospitals does Dr. Buddharaju work at?
Let me see. You know what? I don't have that in front of me. I actually had the list of the hospital. Can you hold on 1 minute, please?
Sure.
Okay. Okay, I have the book right here. And according to this, he works at several. Okay, here it is right here. According to this book, University of Illinois at Chicago teaches medical students from the UIC.
Oh,
Chicago
sorry. Sorry, I had the wrong level up. Could you repeat what you said? Ever since you got the papers back, I had the wrong level up, and we didn't catch your answer.
What was the question?
At what hospitals does Dr. Buddharaju work now?
Okay, so that's okay. The hospitals that, according to this, he wrote a book, and according to this book, he is a clinical assistant professor of medicine at the University of Illinois at Chicago and teaches medical students from the UIC, Chicago Medical School, and internal medicine resident trainees at Weiss Memorial Hospital in Chicago. He directs the Sleep Disorder Center and Clinic at Thorek Memorial Hospital in Chicago and serves as a section chief of pulmonary and critical care at Amita Health Saints Mary and Elizabeth Medical Center, Chicago, where he teaches internal medicine and family practice residents while working in ICU as an intensivist. Additionally, he is president of the medical staff at Kindred, Lakeshore, and Central Hospitals. Well, once again, he was named in lawsuits by patients at Kindred, and he's working at Kindred still. So, for performing unnecessary tracheostomies on those patients, former or other patients at Kindred, but yet he's still allowed to work there again. I don't understand this one.
Okay. So now we get back to Thorek Hospital. He is the chief pulmonologist there, right? Does he have any other position there?
It doesn't look like he's the chief pulmonologist at Thorek. It looks like he's the chief pulmonologist at Weiss Hospital. Weiss.
Okay. And what is his? He's just a physician then at the Thorek Hospital?
Yes, a pulmonologist, yes.
Pulmonologist, okay. All right. And did you, when you looked into the doctor's background, were there other, how many lawsuits does he have against him total now, besides yours?
Let's see, right in front of 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Okay, he is named in 12 lawsuits, medical malpractice, personal injury lawsuits, wrongful death lawsuits.
And what about the government cases? Was that the only one in which he was he wasn't even a defendant. He worked there, but he wasn't named. Is that?
No,
is that...
He was, let me put it this way. There's 14 pages dedicated. So when they first went into, when the FBI, the government first went to start investigating Sacred Heart Hospital, they said and if you read some of the complaint, they said they weren't aware of the deaths associated with, or they weren't aware of the tracheostomies. They weren't aware of that part. But as they got into it, that's when they learned, okay, this is also going on. Why they didn't proceed with that, I don't know. One of the statements I read from the FBI was, it's hard to convict a doctor. I don't know, but they didn't even try. So as a result, there's 14 pages of a 90-page federal complaint dedicated to the alleged actions of Dr. Buddharaju. 14 pages dedicated to the alleged actions of him.
Mm-hmm. And is there any other case against him from any other government or other governmental investigations into his practices?
Well, I'm hoping there'll be another investigation.
But so far, that was the only one, the Sacred Heart case,
the
Heart Hospital case. Okay.
Yes, so far, right. But I'm hoping, based on my complaint, there will be another investigation on him. I'm hoping.
And also, how long after those physicians were found guilty, the Sacred Heart Hospital closed? Do you have any idea? Do you still remember?
Okay, yeah, there was a 90-day, the state has to be notified within 90 days of them closing. They closed once everybody got arrested. They closed abruptly, and I want to say it was like around 30 days because they said they didn't meet their 90-day deadline. A hospital has to give the state so many days to let them know they're closing. And as a result of what they were doing, was that the government had suspended its Medicare payments to the hospital. Mm-hmm. So it went from paying Medicare and Medicaid to they cut them off for 6 months after. That's what they were doing with them. So they just closed abruptly. Mm-hmm. I want to say 30 days after, maybe the 30 days.
Okay. In other words, they closed because they wouldn't get their Medicare payments since the Medicare cut them off, so they just want it
Yes,
to close right away.
yes, Medicare cut them off.
Mhm. Okay. And do you know for your mother, do you know how much did you see the bills? How much was what did the Medicare did Thorek Hospital charge Medicare for all of your mother's care?
I'm assuming that they did charge. I requested from Medicare a list of the things, services that they provided for my mother. I actually haven't gone through them as of yet, but when you file those complaints, those agencies will, in fact, I'm certain that they will, in fact, go through them and determine what was valid and what was invalid. So I personally have not gone through them, but they have called me several times looking for reimbursement a couple of times. So
You mean they said
a
that
few
the
times actually.
Medicare didn't cover everything and they wanted you to pay? What?
Yes, yes.
How much did they want you to pay? Do you still remember?
No, I don't recall because I made it clear to him. I said, so wait a minute. So you all killed my mother and now you want me to pay. And actually, that was the last conversation. I mentioned Dr. Buddharaju's name. And that was actually the last time I got a phone call from them.
And them, you mean Thorek Hospital, or do you mean
Yes,
Medicare?
Thorek Hospital,
Mhm.
yes.
Okay.
The billing
So
department. The billing department would call me
I see. So the billing department of Thorek Hospital called you
multiple
uh,
times, yes.
mhm, to pay for something that Medicare did not cover.
Yes.
I see. And were you able to get an attorney to work on your behalf, or are you doing this all by yourself?
Right now, I'm doing this all by myself because what's so strange about this is, I don't. What's so strange about this is that these attorneys, they say that they're civil rights attorneys. They say that we're civil rights attorneys, but the reality is that I've come to realize that when you try to explain this to them, it's so complex that they really don't get it. I've actually called an attorney that was supposed to be one of the one of the better civil rights attorney. I called him and I spoke to his secretary and I says, listen, I'm filing a civil rights complaint on behalf of my mother based on race, age, religion, and disability. And I get a call back from his son. His son wanted to talk to me and he was started talking to me about medical malpractice.
Mhm.
Well, his website says civil rights. But so I basically had to do it on my own. And so far I've been successful. But also I would like to mention that, and this is one of the things that I found interesting doing all of this, Title 18 of the US Code, Section 242, it mentions both police officers and doctors as having the ability to violate your civil rights.
Mhm.
Title 18, Section 242. I thought that was very interesting.
Mhm.
Prison guards, healthcare providers, police officers. So we all know, the public all knows about police officers having the ability to violate your civil rights. But I don't think the public is aware that a doctor or a nurse or a caregiver can violate your civil rights also.
Kevin,
And they're all, I'm sorry.
yeah, could you do us a little favor? Could you move your camera so that you're centered in the middle there? Now
Okay,
you
I'm
are.
sorry.
That's okay. Okay, much better. Thank you. All right. So so does that mean that if they have the right to violate a patient's civil rights, does that mean that they could get away with medical malpractice then?
No, actually, that's actually the same way a police officer can't violate your civil rights. Neither can a doctor or nurse or caregiver. They can't violate your civil rights also.
Mhm. Okay, they cannot. They're not. They're
They
okay.
cannot
Cannot.
violate your
Okay.
civil
Uh.
rights.
Okay.
And I think the problem is like with the public isn't aware. We're told and taught, or some of us are told and taught and led to believe that the doctor, they have to say so in our care, and the doctor can do this and the doctor can do that. No, that's not true. That's a myth. Yes, they do to an extent, but for the most part, especially for, like in my case, I put it in writing. My mother put it in writing where I would be the power of attorney for her healthcare and medical.
Mhm.
They had no right to do what they did to her. They did a tracheostomy on her and an intubation on her without permission.
Right.
They had no right to do that.
Mhm.
This is
And
not what she wanted.
mhm. And they would have, there was supposed to be a permission. You had to give permission in order for them to do such invasive procedures.
Exactly right. And that's where they violated her rights.
Okay. And
And that's what I filed the complaint based on the violation of rights, Title 18, Section 242, which actually says that your motivations don't have to be motivated by color, race, or other things. It's just you violated the rights. It's that simple.
mhm. And for so would this also qualify as medical malpractice in addition to a violation of civil rights?
It has a medical malpractice component to it. Yes, it does. But I'm going for the civil rights charges,
Mhm.
and the malpractice would be a component.
A component of the civil rights charges is what you're saying.
Uh, a component of the total, the totality of the lawsuit, everything. So you have certain parts within the lawsuit. So yes, medical malpractice will in fact be included, but also the basis that they violated my mother's civil rights. They should have done that.
Okay, so then do you know of other physicians that are doing similar in similar situations that are also working at the Thorek Hospital in his position, like similar cases of what you encountered at Thorek Hospital? Have you run across any other patients that had similar experiences?
Can I tell you something? No,
Yeah,
actually,
go
I
ahead.
have not. But I'm hoping that maybe through this interview, other
Mhm.
people will come forward, and other people will say, "Hey, this happened to me also." Now, what I noticed at Thorek Hospital has, and this is what I was telling some friends. Here it is. I'm English speaking, right? My mother was English speaking. What are they doing to the limited English proficiency population or patients that come into Thorek Hospital? What are they telling them? I know the law, I know the system. So you tell me something that I know that is factually untrue. What are you doing to people that actually don't know?
Mhm.
So I'm hoping that people will, if they hear this, they'll come forward and they say, "Hey, this happened to me." Uh, uh, So that's actually what I'm hoping for.
Mhm.
I'm almost certain there's other people out there, but it generally just takes one to speak up, and it just takes one sometimes.
What have you had any pushback? Have you had any contact from anybody concerning this case since
Uh,
you've worked on it?
well, since like I said, I got responses back from Illinois Department of Public Health. They saying they took corrective actions. I've got responses back from Levanta, which is the actual Levanta. They send complaints to Levanta, and Levanta is a private agency. They have the ability to escalate, and so what they can do is if they see something wrong or something that they don't like, something's not right here, they can actually escalate it to different departments. So once I got my ruling back from Levanta, I understand that in this case should in fact be escalated according to them. That's what they tell me.
Is
But
Levanta like a mediation service?
yes, it's like a third party contractor, a neutral contractor that looks into Medicare health complaints, dealing with Medicare and Medicaid.
Mhm.
They actually deal with that. They're contracted to do. I understand they've been around for years, but once again, if they look at something and they see, once you file a complaint with them, the state actually, I believe the state forwarded my complaint to them. Once they look at it, they can determine, okay, there's something not right here. I think we should dig a little further.
Mhm. And when did you get this ruling from Levanta?
Probably around, I want to say around April.
So that was
And
pretty quick.
yeah, actually, can I tell you something? I believe the reason why I was so quick, actually, they appealed it. Thorek Hospital apparently appealed it. And I was told, they said, listen, normally this takes months for these appeals to come back. My appeal got kicked back in a day after they sent it up, from what I understand. So apparently they think something's wrong here too.
In other words, you're saying that once the ruling came down from Levanta, Thorek appealed, and within one day, Levanta denied the appeal.
Within one day of them reviewing it, Levanta reviewing the appeal,
Oh, I see.
it came back in one day. So, you know, you have to take time for transit mail, other things. But the
Mhm.
lady said, what she said, normally this takes a while, but it came back. We just sent it up yesterday.
Okay.
It's that scathing. I mean, how can you ignore the fact that this man did everything to my mother that he's actually been accused of at a hospital that's now closed. You can't ignore that.
Mhm.
Had I not found these complaints, had I not found these newspaper articles, had I not put two and two together, he would have simply just got away with it. And I was
Mhm.
actually able to get it in a timely manner. Like I said, you have only 180 days to file a civil rights complaint with HHS. After
Mhm.
180 days, they can take it, but you have to show due cause. You have to show a good reason as to why you missed their 180-day deadline.
Mhm.
So I had to learn fast. I had to learn fast from, let's say, the 18th of January to 8th of July. That's when I submitted it.
Mhm. And so you submitted it very fast, July 8th. And when did you get the ruling after you submitted?
Around the 14th, I got a letter back stating that they were going to proceed with everything except the religious part of the complaint. They
Okay.
were going to toss the religious part of the complaint out, but they're going to still proceed with the age, race, and disability part.
Okay. And then afterwards, then what was the timeline? When was the next communication from HHS?
That was the last communication directly
Mhm.
from HHS.
Mhm.
And so now I'm waiting for their ruling, and I'm pretty sure they're going to rule on my behalf because, I mean, how can you ignore all of this stuff? So I
So
filed a
what?
19-page
Go ahead.
complaint with HHS. It was a 19-page complaint.
Yes. And then where did Levanta come in? Was Levanta so HHS was HHS and Levanta was a separate entity, a separate third party that you also appealed to?
Yes, Levanta was a. Well, what happened was, I believe this is what I believe happened. When I made a complaint with the Illinois Department of Professional Regulations and Professional Financial Regulations, which regulates doctors and nurses and basically people that are licensed through the state of Illinois,
Mhm.
or the Illinois Department of Public Health, one of those two agencies forwarded my complaint to Levanta. I
Ah.
then get a phone call from Levanta saying, "Hey, listen, would you like to file a complaint against Thorek Hospital and these doctors?" I said, "Yes, I would." I then uh, this is another thing. I was kind of surprised at the the investigation process. They didn't ask me for any more documents more than what I had actually sent to them until actually the actual appeal. So I thought they would have been more interactive, like, well, do you have this or do you have that, or what about this or what about that? They didn't, and that's the one surprising thing about um, the process, the investigation process of it. I had more information that I could have shared with them, but they did not. They did not ask me for it. But still, in all, I was actually, I actually won that part of the appeal. I won it.
Mhm. What are your next steps now?
my next step now is I'm awaiting HHS's ruling. Okay, they have HHS has 6 months to actually respond. They can actually ask for more times. HHS can actually ask for more time.
How much time could they ask for to limit?
They didn't say. They just say based on the investigation, they can actually ask for more time. Now, if I win HHS's ruling, then I have the ability to file in federal court. I'll be able to go to federal court. But once again, I'm doing this by myself. A lot of these civil rights attorneys, they're not aware. You have to know a little something yourself, or in my case, I knew a little something, but at the same time, I had to learn a lot real fast.
Well, we're really sorry that this happened to your mother. Have you had other physicians take a look into your case, and did they give you any insight as to what another physician would have done to treat your mother?
No, I actually had to do it all myself, believe it or not. I had to do it all myself. And like I say, one of the attorneys, when I first reached out to him, one of the attorneys basically said that my mother was actually, she was old, 88, and she was going to probably die anyway. And I understand that this is why they pick the people that they pick, because they already know how these attorneys think. And so I would have probably gotten very little recourse, or any recourse at all, going that particular medical malpractice route, if that makes any sense.
Yes.
So they pick their victims wisely. They know who to pick out. They know, okay, you're 88 years old. Basically, you're gonna die anyway, and we know who you are. If you go to an attorney, the attorneys are gonna say this or that, and so they know the system.
As to the no visitor policy, so Thorek Hospital has that. Have you and your mother been at other facilities, and where they did not have such a policy?
We had been to Illinois Masonic. We had been to Rush. Actually, ironically, Rush is a very good hospital. Rush and Northwestern, those are two very good hospitals. And what happened was, apparently Rush had gotten a complaint early on in the pandemic about not having their visitor policy also. So they adjusted to this no visitor policy. Apparently, it must have been a memo sent out to the local hospitals. So these local hospitals that are still not allowing visitors were doing it with the knowledge that they might be violating certain rules, and they did it anyway. I found that out later on also.
So what you're saying is that for Rush Hospital, they did not have a no visitor policy, and then it was suggested that they do have it.
Yes, through the federal government suggested, I want to say HHS suggested that they start making allowances for visitors.
Okay, so yes, to have visitors, it's not a no visitor policy. To have
right.
a visitor
to
policy.
have visitors, to have an advocate for your loved one in the hospital. Yes, exactly.
So most hospitals now, have you done any research to all hospitals, or are there any hospitals that still have no visitor policies? Are there many? If there are.
Well, I know January 9th through the 18th at Thorek Hospital, they had a no visitor policy based on the fact that we were in COVID lockdown.
Oh, okay. At that time, yeah.
Yes.
So the COVID lockdowns were going up and going down. So at that time, it was up then.
Right. So COVID basically gave them a green light to kill. They could do whatever they wanted to do.
But however, no visitor is no visitor. No visitor is different from no communication with you regarding your mother's care. If you're not allowed to visit with your mother, you still have the right to supervise your care.
Exactly right, and that's what actually HHS said, that that your rights were not suspended just because we had a pandemic.
Mhm. Exactly. So
Or
that,
you've ever heard that expression, in times of war, the law falls silent? In times of war, the law falls silent. In this case, in times of pandemic, our rights were not suspended.
Mhm.
You still had the ability to advocate for your loved ones, but they were locking people out of these hospitals across the nation, actually.
Mm. So you're saying that there are probably other cases in the U.S. as well where people were not only not allowed to visit, they were also not being allowed to supervise their loved ones' care.
Yeah, yes, that's exactly what I'm saying. All
Mhm.
across the nation, people were locked out of the hospitals and they could not say anything in regards to their loved ones' care.
Okay. Well,
Exactly.
mhm. Well, that doesn't sound right because it's being locked out of the hospital. There is still telephone, there's still computers in which uh, a family member or a loved one could supervise care. It's it's like apples and oranges. That doesn't have anything to do with the other.
Right. Nothing to do with the other. But they were using that. If you're up to no good, you'll use any means available to do what you want to try to do anyway. So if you're up to no good, that's what you'll do. And in
When
this case, Thorek Hospital were up to no good, and that's what they wanted to do. They wanted to lock people out so they could do what they thought they could get away with.
this is WZRD Chicago 88.3 FM. And we have with us retired Chicago police officer Kevin Clenna talking about his experience with Medicaid fraud. And so Kevin, when you weren't allowed to supervise your mother's care at that time, what did you do? Did you go to anywhere to protest to file a complaint? Did you go to the hospital administration? What did you do?
Well, what I did was I ended up eventually, I talked to a couple of lawyers, and once again, unfortunately, these lawyers, this is what some of the responses I was given by, I'll tell you at least one lawyer. Well, I'll tell you experiences, but two lawyers. One lawyer told me that, okay, well, a doctor can do that. He can do this and do that. But once again, I knew that that was factually untrue. I had a friend that's actually a Harvard trained medical doctor, and she says, don't allow them to tell you that. They can't do this and they can't do that. So I knew that was not true. A second lawyer actually told me, well, due to Governor Pritzker's um, mandate with COVID and other things, these hospitals have been given a lot of authority and they can do certain things. So I talked to two attorneys. The two attorneys um, told me opposite. I'm not saying that they told me that because they were trying to deceive me. They actually didn't know. A lot of people actually didn't know what was really going on as far as what these laws meant and what they didn't mean and other things. But they were basically telling me that there's nothing that I could do. I actually called the 1-800 abuse hotline uh, to try to get some help. So no, I have documents where emails where I was sending emails out at 2 o'clock in the morning telling them that I hadn't been able to see my mother for 9 days. So no, I did try to reach out to some attorneys.
Mm. So you said that one attorney said that they couldn't do that, and another attorney said that they could. That's
Yeah,
basically.
well, no, both attorneys said that the doctors basically have the say so with this or the say so with that. Another attorney said that under Governor Pritzker's mandates, they've been given a lot of authority.
Mhm.
So that's what I was told. Basically, I was told by both attorneys there was nothing I could do about it.
I see. Got it. Well, and then what did the 1-800 abuse hotline tell you?
It just, I believe I might have left a message or it just rang, but I got
No follow-up from them.
yeah, no response from them either.
Did you call anyone else? Did you call 301 and anything else? Anyone else?
No, I did not at that point, because who thinks that they're going to, I mean, this is the United States of America. I would have not thought that I would have encountered a doctor that was involved in Medicare fraud. I, you know, naively, I had more faith in our system,
Mhm.
but who would have thought that I would have discovered this or encountered that? Now, who would have thought that they weren't feeding her and they weren't doing this at a so-called accredited hospital?
Mhm.
Who would have thought that?
They weren't feeding her? Did you find that out as well?
Yeah, she only had 200 millimeters of mucus in her system during the autopsy.
And what does that indicate?
She had no food. She had no food in her system, and she had only amlodipine and caffeine in her system. That's all she had.
So what was the
Amlodipine and caffeine. That's all she had in her system, according to the autopsy.
the medical examiner said that it was the not being able to breathe or the aspirin lodged in her throat.
They said
Cause of
the
death.
medical examiner said the primary cause of her death was COVID and/or aspiration pneumonia. COVID and/or aspiration pneumonia,
Mhm.
according to her autopsy report. I had to get a private autopsy done on her.
Okay. So does that mean that the state medical examiner wasn't willing to do an autopsy? You have to do it private.
Exactly. The Cook County coroner was not willing to do it, but keep in mind that the Cook County coroner uh, was appointed by the Cook County commissioners. The Cook County coroner is appointed by a Cook County medical examiner
Yes.
is appointed by the Cook County commissioners, and it appears that one of the people at Thorek Hospital is related to a former Cook County commissioner. That's where it gets a little sticky at.
Mhm.
So the Cook County coroner, a medical examiner, originally when I reached out to them saying there's something suspicious about my mother's death, they wouldn't do anything. In fact, I got a call from his man's name was Mr. Briggs at the Cook County Medical Examiner's office, and he says that we don't do autopsy. You'll have to pay for blah, 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 blah. And I did. So I went and hired a company out of Indiana, and they did the autopsy. They picked my mother up. They took her, did the autopsy, got the results back weeks later, toxicology report. Now, all of a sudden, the Cook County Medical Examiner wants to get involved, and in their report, it says that her death was basically natural causes, but it made no mention of the pill. It made no mention of COVID. It made no mention of the aspiration pneumonia.
Mhm.
None of that.
In
It
other
just said
words,
death was natural.
the Cook County medical examiner did an autopsy after your private autopsy, and then they said that it was natural causes.
No, they actually did not do autopsy. They refused to do an autopsy when I requested that they do
Right,
an autopsy.
right. I
But
understand.
what was happening what was happening was the people that was responsible for my mother's burial, they were calling trying to get the death certificate signed. Nobody at Thorek Hospital was signing a death certificate. No,
Mhm.
not one person at Thorek Hospital was signing. Even though my mother was seen by 15 doctors at Thorek Hospital, not one of those doctors signed the death certificate. So therefore, my mother was in limbo. And after my mother being in limbo, uh, that's when the medical examiner, I guess they contacted the medical examiner, and that's when the medical examiner got involved. And once again, they made no mention of the pill on my mother's, stuck in my mother's upper esophagus. They made no mention of the aspiration pneumonia. They made no mention of the COVID. They made no mention of those.
So what you're saying is that the Cook County Medical Examiner came in because no doctor at Thorek Hospital would sign a death certificate. And
Yes.
the Cook County Medical Examiner did sign the death certificate and listed the cause of death as natural causes without having performed any autopsy.
Yes.
And did they have any access to the results of the private
Yeah,
autopsy?
they did. They had access to all of that. Actually, when I called and spoke to one of the investigators, and he said, "No, we have all of that." And he actually, just between me and you, gave me. He said, basically, when I spoke to him again, he said, "I knew you would have questions, so you can call her secretary and talk to her."
Did you call the secretary to talk with
Yeah,
her?
I called. I was actually surprised that the death certificate made no mention of COVID, made no mention of aspiration pneumonia, made no mention of a pill lodged in her throat, which we learned later after looking at the medical records had been lodged in her throat for about 24 hours. Yeah, made no mention of anything. But once again, I would like to say that the Cook County Medical Examiner is appointed by the Cook County Commissioners, whose husband, yeah. So the Cook County Medical Examiner is appointed by the Cook County Commissioners. The former Cook County Commissioner's husband now works at Thorek Hospital as a CEO. It looks like this is the same Peter Kimberos. I followed the money. It looks like this is the same guy. So I don't know what's going on here, why you would do that, or maybe I'm thinking maybe that, lay people wouldn't know who he is, or lay people wouldn't know who's, put two and two together. But Peter Kimberos, that's who they said is married to this former Cook County Commissioner.
Mhm. And also, is Thorek Hospital a private hospital?
No, it's actually they say it's a not-for-profit hospital, but it gets Medicare funds, as they have a Cook County flag flying in front of it. It gets Medicare funds.
Mhm. Okay, so private hospitals are they allowed to get Medicare funds?
Yeah. Most hospitals are funded in the U.S. through Medicare, Medicaid.
Mhm.
So it's a not-for-profit, but they can become eligible for Medicare funds.
Mhm. Yeah. Well, and so now you're waiting for the finding of HHS
Yeah.
and then also you might follow up with those other entities to just at least to get cover all the bases.
Right.
Mhm.
Exactly. I will follow up with those people,
Mhm.
like was suggested to me, which is a good idea,
Mhm.
just to have to document their response so they can't say I didn't reach out to them.
Mhm.
So, but no, I actually do plan on doing that. That's a good idea, actually.
Well, Kevin Clenna, sorry that you had to go through all this with your mother and that you lost your mother. Hopefully, uh, the issue will be resolved and this doesn't have to happen with anybody else. And we will follow up with you to see how what uh, what other resolutions you find that are coming down with all with all your work.
Okay. Well, thank you very much for having me. Like I say, hopefully other people will hear this story and they'll come forward and we can get something done. But my mother's not the only victim in that hospital. Trust me on this one. They were too bold and brazen, and it was abnormal behavior. So they've been doing a lot up there, and hopefully the government will get
Mm,
down to the bottom of it.
and just so the doctor Buddha Praji, right? What was his name?
Buddharaju.
Buddharaju. Sorry about that. He has been working at Thorek Hospital since 2010, right?
At least I've determined that they've had a relationship at least since 2010. The Sacred Heart scandal broke in 2012, about around 2012. That's when it broke, I believe. And with that being said, they knew what kind of person they were dealing with. They knew it.
Because at that time, what about the press? The press, did they have Dr. Buddha Praji's name in the articles at that time?
There's just one. There's one article that Crane ran. You know, Cranes.
Chicago Business.
Chicago Cranes ran an article that said simply, we may be physician D, and it described his actions, and Dr. Buddharaju's Modern Healthcare report, Chicago pulmonologist may be physician D in Medicare fraud case, Crane Chicago Business. It says a Chicago pulmonologist has been identified as holding the same position at Chicago Sacred Heart Hospital as physician D, the doctor federal authorities say performed a medically unnecessary tracheostomies at the Westside Hospital, according to a report. Dr. Venkata Buddharaju has not been formally accused in any aspect of the federal investigation at Sacred Heart, where FBI and the U.S. Attorney's Office in Chicago have alleged that administrators and doctors engaged in various schemes, including kickbacks to physicians intended to defraud the Medicare program. So no, it's called Modern Healthcare. I don't know if you can see this, but this is it right here, Modern Healthcare.
Okay.
Crane Chicago Business.
Yeah. If you have the link, also send that all of the articles that you sent to us. Please send us the link too, and that so that we could share it with our listeners when we publish this interview.
I sent. I don't know. How would you like me to send it? Because I actually sent everything that I have here yesterday. You say send a link.
Yeah, the link to the original articles. File. Yeah, the links to the original articles if you have them.
Yeah, because I sent them there in your emails.
Okay, the links are there then? Okay, I was just looking at the attachments. Okay, then that's, that's sufficient.
Yeah, everything that you sent, everything that I'm talking about here today has been sent to you already.
Okay.
If by some chance you don't have them, just reach out to me and I'll make sure you get them again.
Okay. Yeah, we did receive the PDFs, but we were just hoping that we also get the links so that the listeners could access them online.
Oh, I understand what you're saying. That is kind of above my pay grade right now.
Oh, that's okay.
Links.
Yeah, don't worry about it. We might be able to get a link for those PDFs, so that's fine. If you're able to get them, that's good. If not, that's fine. But you do send us the links for those court cases. You said that it's all the complaints, the court complaints are all at a link, the court documents. So do send us the link for that. And for the doctors, you said the other physicians that were found guilty, they said that Dr. Buddharaju was in charge. So he should have been the one that was indicted and found guilty, right? Is that what those the defense attorneys for those other doctors said?
Yeah, the defense attorney is like, you're not charging him, you're not doing this with him. That was a defense attorney for the other attorneys, because he was surprised that why is it that this guy that you basing your case around is not being charged at all? That was his question in open court.
Okay, if the case was based around him, because those charges, those false charges, for profit, though it was Dr. Buddharaju that was doing it. Is what the
the tracheostomies and the intubations. Those are considered painful invasive surgeries, that's what was so sensational about this case, was that you were cutting on people to do this, unnecessary cutting.
Mhm.
And they just let him walk away. I don't get it.
Mhm.
I don't understand why they just let him walk away.
Mhm. Well, let's see if there are other people who have experienced the same, and maybe they will come forward and share their experiences as well. Thank you so much, Kevin, for sharing the story with us and bringing light to this matter, this case of malpractice to our listeners. Thank you so much.
Okay, thank you very much. I appreciate it. Thank you very much.
Be safe. Thank you.
Okay, goodbye.
Goodbye. Goodbye.